Hi everybody, Dr. Stu back in the chiropractic room across the main line, Ardmore, Pennsylvania for another episode of our mobility videos that we're doing here for the month of October for our Healthy Lifestyle Fitness Challenge we're having here at the box. The mobility we're going to focus on today is something that I see quite common in my chiropractic office, and that's people complaining of some hip problems. With this lack of mobility or actually hip pain, sometimes some mild distraction of the hip can alleviate some of that discomfort and increase the mobility. As a chiropractor, I also adjust the hip as well as the knee and ankle, because any joint in the body can become dysfunctional. So this is something you guys can do on your own in addition to getting evaluated at the office. So the way the gentle hip distraction works is you bring the elastic band over the top of your foot. Say we're using, again, I always say you can use your imagination. Since we're in the chiropractic room, we don't have the rig to use the band, so a 45-pound plate works just as well as for an anchor. So what you do is you come over the top of the foot, and as you come up, you cross the band underneath, and you get the foot through there. And then as it crosses over, you bring the band over to the top. Now don't get as caught up with where the band is, but you don't, this way, I like it this way, so if the band's on the outside, it's going to force your ankle into external rotation, and that's what happens during exercise when people roll their ankle. So you want to keep the bands to the inside. So with this particular one, you're going to lean back and get a nice stretch. And what this does is gently distracts the hip joint. It also distracts the knee and ankle by default, but these are all good things for our lower chain mechanics. So now you can also come back on your ankles, on your elbows, and get a nice little stretch and distraction here. Another one you get more bang for your buck is you can also work on the knee distraction, and you'll isolate the knee a little bit more if you lock off above the knee with your hands and hyperextend your knee, but don't hyperextend it, but push into extension as you lean back, and that's going to help isolate the knee capsule and stretch it out as well. One way to get that hip a little bit more is you can use the benefit of a roller, get the roller underneath the ankle, and then you can actually lay back on it and lean back and roll and get a nice distraction in that hip. Sometimes in the office when I work, you actually get an audible where it sounds like a clicking noise of the joint as it gets back realigned. Gives a lot of relief and actually helps mobility and range of motion. So work on this one as all the other ones. You want to make sure minimum 30 seconds, up to 2 minutes per hold. Get those tissues pliable, get them flexible. And this is going to help you with a lot of the different exercises we do with our hip mobility. So hope you found it informative. If you have any questions, ask the coaches, ask me at the box, and good luck with the rest of the challenge. See you next time.